Hello, I am Dr. Sanjeev Gulati, Principal Director Nephrology and Kidney Transplant Fortis Group of Hospitals, NCR and immediate past President, Indian Society and Nephrology, and you are watching my YouTube channel Dr. Sanjeev Gulati Kidney Clinic Joe. The latest advances in kidney diseases tell you the latest research, so don't forget to like and subscribe. Today we will talk about diode chart for CKD patients. So chronic kidney disease is increasing very fast, and look at the general population. So 15-20% of people have different degrees of chronic kidney disease. So whoever is seeing this, you should also check whether your kidney is healthy or not. If you have chronic kidney disease, then you will have to take some diet precautions. And these diet precautions depends. Severity of kidney disease, I have told in the video that chronic kidney disease occurs in 5 stages. Stage 1, 2, 3, 3A, 3B, 4, 5, while stage 1, 2, 3A requires very minimal diet precautions, 3B, 4. And in stage 5, diet precision is definitely needed a little more. So now we will talk about diet. Water intake is the first part of your diet. So if you are feeling good with stage 1, stage 2, stage 3 or urine. Even there are some patients who are also in stage 3B who have good urine output. Then there is not much restriction of water intake because the kidney has many functions. One of them is the removal of water from the body. So we measure how much urine is being produced. If your urine is producing more than 2.5 liters, water can be taken freely. If these factors are taken less, dehydration can occur. Try not to drink too much water. Many YouTube channels that say drink too much water, that water will flush from your kidneys. That is wrong. Along with water, I would like to tell you that the beverages are. You can take coffee, but those beverages like Coca-Cola or something like this produce very high uric acid. So these things in chronic diseases, keep it limited. They also have high phosphorus levels. Happens. If you want to take it very much, then take 2 or 3 sips and also take non-cola drinks, i.e. like Limca or 7-Up. The phosphorus content seen in these is low, but in all these uric acid increases and sugar increases. Then we will talk about what are the components of the diet. There are carbohydrates, there are feeds, there are proteins, there are vitamins, there are electrolytes. Then carbohydrates, we need at least 35 kilocalories. There is no restriction on total calorie intake and carbohydrates. Yes, if you have diabetes, then definitely the complex carbohydrates you should take and make sure that your sugars are under control. But if your appetite seems low and you have to take carbohydrates, then you have sweets if you are not diabetic. You can eat in an unlimited amount. Eat rasgulla, eat Chinese sweets. You can also take fats. It is also a misconception that patients with chronic kidney disease have to restrict fat intake. Yes, the vegetable sources of it is oils that we prefer, which is called unsaturated fats. And it was seen that coconut oil is very digestible. And you can take the rest of the oils on a cyclical basis, like you can take soybean for a month. If you take mustard oil for a month, many times our patients ask that you can definitely use ghee in a small amount. These are the necessary calories that we deliver to your body. The protein index is the most. Miss is the managed part, and most people get this misinformation from their neighbors and from which your protein is completely shut down. But if you have a predominantly vegetarian diet, which is of most people in India, then you do not need any protein restriction. Yes, lentils. Eat what you have, soak it in water at night and boil it in fresh water in the morning. You can take soy, you can take cheese, you can take tofu. If you don't have protein is your own. The body will be completely cut down from the diet. So your body goes into a phase. There is a breakdown of your muscle. You will gradually become weak, and one thing will come that you will not be able to get up for so many weeks. Then protein restriction is not required in a vegetarian diet. How much protein can you take? You can take kg protein at ICL 0.8 grams, which is quite difficult to take. Vitamin E, which is a water soluble vitamin, there is no restriction on it, which is a burst soluble vitamin. It should be taken under prescription, under monitoring. Vitamin D, I've seen, do self-medication, and many of them increase calcium a lot. So take vitamin D under supervision. Last, I will tell you that kidney plays a very important part of electrolytes in your electrolyte regulation, and as kidney disease increases, then potassium and phosphorus in the body, there are accumulations. It exits through the kidneys, but its effect is on the heart. Therefore, we have to restrict the dietary components that are rich in potassium and advanced kidney disease, and it includes fruit juice, dry fruits, and then coconut water. It falls into this category. Things made of jaggery, and in winters, we have seen that people are drinking turmeric by putting it in milk or drinking ginger tea 4 or 5 times a day. So all these things you have to do. But Indian spices, which they can be taken in unlimited amounts, are very friendly, and if you add more spices, then you can reduce the salt. So number 2, I will tell about salt that most of the patients have. Blood pressure is high, so you need to reduce salt in your diet. Which salt to take, we have made a detailed video, but Tata iodine salt, which speaks common salt, take the same. Low salt or super light salt is considered strict for first patients with chronic kidney disease. Phosphorus comes in third place. Phosphorus levels build up in the body. Phosphorus comes with protein. So there will be some amount of phosphorus, but phosphorus we should monitor the levels, and phosphate binder advises all people to give it with food which contains calcium compound. Also, you should see that dairy products do not take more than 300-400 ml. The butter or lassi you have in it also gives empty phosphorus. It gives phosphorus, does not give protein, so you should avoid such things. So these are a nutshell if you have chronic kidney disease. You can take most of the things that are in the Indian diet freely. Spices, eat food with Indian spices. No need to eat boiled. You need to consume less salt. Do not consume more than 3 grams of salt, and foods high in phosphorus and potassium. A little restricted amount first, thank you.
Generate by AI.